Telemedicine can bridge that gap. It can get people specialty care that they never would have been able to get to otherwise. I've seen patients and treated patients who were 3 hours from the nearest hospital and who were suffering, and their families were suffering because they just couldn't get access to basic care that would have been available in the cities. We were called to see an elderly woman who had been brought in from home. She had a history of dementia. She had Alzheimer's, and the family had been managing her at home relatively well up until this point, and over the course of 4 or 5 days, she had become increasingly confused, combative, aggressive at home, difficult to manage. They brought her into the emergency room, and we were able to see her. It turns out she had an infection going on and was developing an acute delirium. We worked with the team on the ground to get her medications straightened out, to reduce her level of confusion, to control the degree of agitation. By the time we had worked with her for a couple of days, she was calm, she was cooperative. The team was able to treat the underlying infection and get her mental status starting to correct, and eventually she was able to go back home with her family. So I think that was a good example of a case in which someone who otherwise probably would have ended up in restraints or would have ended up in a nursing facility because they were unmanageable at home, we were able to work with both the team on the ground and the family to get her appropriate care and get her stabilized.